Congenital tremors and salt poisoning in swine. The congenital tremors are myoclonia congenita, which is shaking piglets or dancing pig disease. It happens in newborn piglets. They have rhythmic, uncontrollable tremors, and it's milder in rest. Type A has hypomyelinization, which is detectable. There's type A1 to A4, and then type B has no lesions visible. Type A1 is caused by African swine fever. It affects sows in all ages, and the infection happens from day 10 to day 50 of pregnancy. They get cerebellar hypoplasia and dysplasia. There is also spinal cord hypoplasia, and the spinal nerves get hypomelanogenesis. This condition has a high mortality. Type A2 is caused by porcine circovirus 1 and porcine circovirus 2. It is the most common. It affects litters of gilts, so the piglets in both sexes. They have no cerebellar hypoplasia, but they do have hypomelanogenesis, and there is a low mortality and a high morbidity. It decreases after week 8. For myoclonia congenita type A3, it's hereditary, especially in landrace males. So it affects male piglets from landraces and their crosses. They get hypomelanogenesis, and in the histopathology, there is decreased oligodendrocytes, and there is a high mortality. For myoclonia congenita type A4, it's hereditary autosomal, and it's found in Hampshires or belted breeds. It is an autosomal recessive trait. It affects adults and both sexes, especially sows of all ages. They get hypomyelinogenesis and decreased lipid content of the myelin sheath. There is a high mortality and a morbidity of up to 25%. And myoclonia congenita type A5 is caused by organophosphates. It occurs when they receive organophosphates around halfway through the pregnancy, so around day 45 to day 63. It affects sows of all ages and piglets of both sexes. They get spinal cord or cerebellar hypoplasia and hypomyelinogenesis, and there's a high mortality and a high morbidity of around 90%. And for myoclonia congenita type B, the cause is unknown, and they get nerve functional disorders. And for poisonings such as salt poisoning, it happens when there's a water supply problem or high salt content in the feed. Or it can happen when they're eating human salt for several days. Signs occur after 24 to 48 hours if there's a disruption of the water supply. They start to show signs of aimless wandering and blindness. And they can also get central nervous system problems such as meningitis, so they can have head pressing, ataxia, nose twitching, and seizures. For the treatment, it's usually unsuccessful. Try rehydration through pyrosmines rectally or intraperitoneally. Other poisons include mycotoxins and pigweed.